Hello everyone, my name is Dr. Dima El-Sharkawi and I'm a haematology consultant at the Royal Marsden Hospital. I treat patients who have lymphoma and CLL, and I'm also clinical lead for our diagnostics unit, and that's where we diagnose different blood cancers including lymphoma and CLL. So in this video, I'm going to talk to you about high-grade non-Hodgkin lymphoma. So first of all, to talk a bit about what lymphoma means. Lymphoma is a cancer of your lymphocytes. Now, lymphocytes are one of your white blood cells which form part of your immune system, and their normal function is to fight infection. Now, everyone has two types of lymphocytes. You've got B lymphocytes and T cell lymphocytes, and either one of these can become cancerous, and that's why we have B cell lymphomas and T cell lymphomas, depending on which cell has become the cancerous or the lymphoma cell. High grade really refers to the cells being rapidly dividing. So we can get high grade B cell lymphomas or high grade T cell lymphomas. And these are both considered non-Hodgkin's lymphoma, as they are not Hodgkin's lymphoma. So they come under this umbrella term of non-Hodgkin's lymphoma. The majority of patients with high-grade non-Hodgkin's lymphoma have B-cell lymphomas, although, as I say, there are some with T-cell lymphomas. Now, these lymphomas, because they are high-grade and because the cells are rapidly dividing, a lot of patients are quite symptomatic. They can notice the lymphoma themselves before they're diagnosed. This isn't always the case, but most frequently it is the case. So patients may happen to notice that they have a lump that is often rapidly enlarging. Depending on where the lump is, it may cause different problems. So, for example, if someone's got lymphoma that's near their back and spinal cord, it may cause neurological problems. It may cause back pain, for example. Or if it's under the arm, then they might notice a lump appearing under the arm. There can also be generalized symptoms when patients present. So this is by the very nature of having a rapidly dividing tumor in the body that you may feel generally unwell. Patients may be losing weight as a result of having this. They may notice night sweats as well. And this isn't just being a tiny bit sweaty at night because your duvet's too thick. This is proper drenching night sweats where patients may often, they tell me, have to shower in the night or change their bedclothes several times a night because they're soaked through. So these are the kinds of symptoms that patients with high-grade lymphoma can often present with. As with all cancers, the only way of absolutely diagnosing lymphoma and the subtype of lymphoma, because as I've already explained, it's quite complicated with all these different subtypes, is a biopsy. We need to take a sample of the abnormal tissue to be able to look at it down a microscope and also do further tests to exactly identify the type of lymphoma, whether it's B cell, T cell, Hodgkin's or non-Hodgkin's, but also to then keep going down until we get the final diagnosis. Because, for example, even within the high-grade B non-Hodgkin's lymphoma, there are several subtypes of high-grade B non-Hodgkin's lymphoma, the most common one being a disease called DLBCL, or diffuse large B-cell lymphoma. But as I say, there are other subtypes. So the biopsy helps us diagnose the specific type. Once we've got the diagnosis, the next thing we do is stage the disease. That is to say, we know the disease is where we took the biopsy from. Where else in your body is it? And usually for high-grade lymphomas, the way that we stage the disease is with a PET scan, which is a special type of CT scan where patients are injected with radio-labeled glucose sugar to help light up as a hotspot areas of disease. Now, things may not happen in this exact order. Some patients have had the scan before the biopsy, depending on clinical suspicion of the symptoms, but essentially we need to be able to decide on best treatment to know, what the subtype of lymphoma it is, and the stage. And then also there'll be tests performed to look at what a patient's fitness and general organ function is like. So this would include blood tests to look at normal blood counts, to look at liver function, to look at kidney function. It may also involve assessment of the heart function with a scan to look at the heart. This will help us decide on best treatment. Now, to go back to the staging, with lymphoma, because as I've said, this is a cancer of one of your blood cells, and we know that blood travels around the body, either through the bloodstream or lymphatic system, more often than not, the disease is in more than one place before it's diagnosed. And for us, it doesn't have quite the same connotation as it does for other cancers, where it makes a big difference whether the disease is in one place or several places. For us, it may affect prognosis, but also it affects how much treatment we want to give. For those patients that have disease in several places, we may want to give more treatment than in those few patients who only have it in one or two places. But ultimately, for most patients with a high grade, particularly B-cell lymphoma, our aim with treatment is to cure patients. That's even in those who've got more advanced stage disease. And by advanced, we generally mean stage 3 and stage 4 disease. So our main treatment is chemotherapy, as chemotherapy treats the whole body rather than a more targeted treatment. Our chemotherapy is usually given in conjunction with antibody therapy for those patients with B-cell lymphomas, as we have an antibody that can specifically target a protein that is on the surface of the B lymphocytes. And so if you have a B-cell high-grade non-Hodgkin's lymphoma, one of the most common chemotherapy regimens we give is something called R-CHOP or R-Polychip chemotherapy. As I said, there are other high-grade B-cell lymphomas and T-cell lymphomas where the treatment is slightly different. And as always, we would look at the diagnosis, the staging, and also what treatment we think a patient would tolerate to help make the best treatment plan for the individual patient. With the treatment, we will generally start treatment as soon as a patient has been diagnosed and has had all the workup investigations required. There are other forms of lymphoma where there may be patients that we just monitor for a while before treatment, but usually with high-grade lymphomas, we want to treat straight away because we are aiming to cure and because this is generally a more aggressive disease. Once treatment is complete, but also usually halfway through treatment, we will repeat a scan to see how well someone's disease is responding to the treatment. And at the end of treatment, we will want to see that the disease has gone. If the disease has gone, then we would monitor patients afterwards in the clinic to check that they're recovering from the treatment that they've had, any further problems, and if they develop any new symptoms, to see whether that's because the disease has come back. If the disease hasn't gone completely with treatment, or if there is a suspicion the disease hasn't gone completely with treatment, we may want to do further tests and further biopsies to see whether that is definitely the case, and then think about different treatments at that point. And depending on which subtype of lymphoma you have will affect what treatment we give subsequently. Overall, the advances we've had with high-grade lymphoma, particularly with diffuse large B-cell lymphoma, are quite a lot, particularly in the last few years, and the different ways that we're treating lymphoma, particularly in those patients who don't respond to the standard first treatment, has changed dramatically. And so overall, the outlook is much more positive now than perhaps it had been, 20, 30 years ago. Thank you very much for listening.